Today we're going to talk about ultrasound treatment, and specifically we'll talk about non-thermal ultrasound therapy and when this is appropriately used. So we'll use another patient scenario, and the patient is a 53-year-old man named Ronnie, and Ronnie tripped in a gopher hole and injured his lateral ankle. And so he came into the clinic 2 days after, and he's in an acute condition at this point. And so, there's a lot of inflammation. He's kind of overlapping into the proliferative stage where, more fibroblasts will be recruited to lay down collagen and repair that injured area. And so you would want to use the non-thermal treatment just to not exacerbate the symptoms of inflammation there. So indications for the non-thermal treatment are things like, the pain in the area. It's going to help drive a lot of cellular processes through microsteaming and through air cavitation that will help to drive the cellular fluids and help repair that injured tissue. So there are just a few things that we'd want to be careful about when applying this kind of treatment, and that would be if you had poor sensation, poor regulation of temperature in that area. I think those would probably be the main ones with Ronnie, where he has diabetes, just making sure he has the appropriate sensation there and circulation. And, other things with maybe other patients you'd want to consider are, in children, you have to be careful of epiphyseal areas. You'd want to be careful if someone has a pacemaker, if you were going to apply it close to that area, or if someone was pregnant. So those are just some of the conditions involved with using this therapy. And we'll go ahead and move into the clinic and demonstrate this on a patient and go from there. Hey Ronnie, how you doing?
Doing good.
Well, I'm sorry to hear. I understand you hurt your ankle in a gopher hole.
Yep.
Staying gophers. So I'm going to recommend that we do a treatment called ultrasound. Are you familiar with ultrasound treatment for physical therapy?
A little bit.
Okay, so most people think of it as imaging, prenatal imaging, but we can also use it for therapeutic methods. And basically, this instrument will use acoustic vibrations to help with the tissue to regrow and to heal. So the type of ultrasound we're going to use, because you're in an acute stage, it's only been 2 days since your injury, is a non-thermal ultrasound. And basically I'm just going to use a medium and kind of have a circular motion around that area, and it's going to help with promoting that healing. So does that treatment sound okay? Are you comfortable with that?
Yeah, that sounds fine.
Okay, perfect. So a couple of things before we start. There's a few things that we want to make sure aren't issues with this kind of treatment. So do you have any poor sensation in that area?
No.
Okay, so no problems with temperature regulation or anything like that? Okay.
No.
And do you have good circulation there? Does it seem like?
I think so.
Okay, perfect. All right, so it sounds like that'll be fine then. We'll go ahead and move forward with the treatment. Okay, so I have Ronnie comfortable here on the table, and I'm just going to show how to set the parameters on the ultrasound machine. Okay, so there's an ultrasound button in the corner here. You're going to press that once. This type of therapy is going to be mostly superficial. I'm just going to need to penetrate about 1 to 2 centimeters deep. So I'm going to go to 3 megahertz. And then because we want to do a non-thermal treatment, because this is an acute injury, we're not going to want a continuous cycle. We're going to want to change this to 50%. The intensity that we're going to choose is probably going to be around 0.5. And then I'm going to do the treatment for about 8 minutes. So I have everything all set up here. The next important thing is just having this in contact before I press start, as well as having the coupling medium already present there on the skin or on the head of the instrument. Okay. Alright, Ronnie, this might be a little cold at first because of the gel. Are you comfortable like that?
Uh-huh.
Okay. So the head of this instrument is not typically the whole effective radiating area. We're going to want to do about 2 to 3 times the size of that determined by the instrument. So you'd have to determine what that is, and you would do 2 to 3 times that size around this injured area. Okay, so I'll just do that for about 8 minutes for the patient, and then I'll go ahead and come over here and turn that off while it has contact. Sorry, a little hypoglycemia going on here.
No worries.
Okay, and then I can turn off the device and I just check on the patient. So Ronnie, did everything go okay with the treatment?
Yeah,
Do you have any questions about it?
I don't.
Okay, perfect.